Bob Harvey, Vice Chair, and Jean DiGirolamo, Dr. Damsker from our Health Department, as well as Scott Forster from our Emergency Services Department, and Evan Stone from our Planning Commission are joining me as well. The three commissioners will make a few brief statements, and then we will move on to the rest of the crew, and then we'll take questions. So we are here today because of the briefing that was presented by Governor Wolf and his directives. He made several directives basically mimicking what is going already on in Montgomery County and Delaware County to Bucks County. The first thing we want to say is that everything is okay and everybody can take a deep breath. Things in Bucks County are fine and your county is open and functioning. What the governor has closed is schools and daycare centers. He has also closed adult care centers, as well as asking everyone to continue the idea of voluntary social distancing, and also businesses to be mindful and make sure that they are putting social distancing efforts into effect. Just so that people know, if your senior center is closed, and some of them are remaining open, there are still meals available. If you contact your senior center or our area agency on aging, we will make sure that you are connected and know where to pick up a meal, or they will make sure they deliver it to you. As far as schools that are closing right now, Pennsylvania has received approval from the federal government to allow schools the option to continue to distribute meals at no cost while the schools are closed. School districts are right now working with the Pennsylvania Department of Education to expedite those approvals, and you should check our website, but as well check your school district website so that you'll be able to determine where meals are being offered within your school. The other issue that has come up is daycare centers that are closed. There is a waiver process, so if you are the owner of a licensed daycare, you should know that you would be able to call the OCDEL office and apply for a waiver if there is a reason why your daycare center needs to be open. You can contact the county as well if you need some assistance with that. And the last thing that I just wanted to say is we are calling on leadership in Harrisburg, and specifically in the House, to cancel the special election that's supposed to be held in Bensalem next Tuesday. We are concerned with both being able to staff that election as well as people's comfort with being able to come out and vote given the situation and the social distancing recommendations. So I would like to next introduce Commissioner Bob Harvey, who will share some of his concerns.
Thank you. We appreciate the governor's directives that he issued earlier, copying, as Commissioner Marseglia said, what he talked to in terms of Montgomery County about. Some of the things the county, Bucks County has already done. Several days ago, we had already started limiting visitation to the correction centers here in Bucks County. We'd also limited public visitation to Neshawnee Manor, which is a county-owned center for senior citizens. We strongly recommend other senior care facilities consider making visitation restrictions. We do know that this virus, so far at least, seems to be affecting people who are seniors more seriously. Keep in mind, Pennsylvania does have one of the oldest populations on average. I believe only Arizona and Florida have an older average population. Bucks County itself is approximately 18% of the population is above the age of 65, which is about 1 out of every 6 Bucks counties. So the measures that you hear about being taken, that the governor is asking, and in some cases enforcing, obviously are extreme. Certainly, not many people remember these kinds of restrictions at any time in any recent memory. However, if it does end up preventing the spread of this disease, the spread of this virus, especially to members of our senior community, certainly I think we all can agree that it's worth it. We would ask that, as Commissioner Marseglia said, business owners be mindful of the kind of operations they're conducting and doing it in a way that's safe for themselves, for their employees, and for their customers. We would also ask residents of Bucks County to be conscious of the fact that this is going to be a tough couple weeks for businesses, large and small, but especially for small business owners throughout our county, some of whom are operating just above the profit margin on a daily basis. Keep in mind that they deserve as much of your patronage as possible. And when this does end, which it will, of course, at some point, maybe we can help them out even more by attending and going to their their businesses as much as we can. In addition to the county government being open for those, and as long as the weather stays nice, this will apply. The Bucks County Park System is still open, and so for those that are looking for things to do aside from binge watching and looking at their phones, they can certainly take advantage of the park system that we have here in Bucks County, which is, we believe, second to none. I'll allow Commissioner DiGirolamo to say a few words.
Good afternoon, everyone. Good to be with you today. What we're dealing with here, it's certainly unprecedented. Someone said that this is the biggest health emergency that this country has faced in over 100 years, and I think that's probably right. We don't have a blueprint or a map to look at and go back and say, well, here's how he did it 10 years ago or 20 years ago. But I just want to assure the people of Bucks County that their health, safety, and welfare is our #1 priority. And when I mean our #1, I mean not only the commissioners, but all the departments, the department heads, and all the employees, the great employees that we have here in Bucks County. And just a couple quick, and I think common sense, simple things to realize. And to keep it in their mind, these safety issues about washing your hands for 20 seconds. So important about making sure, especially our senior population, is safe and secure and out of harm's way. Social distancing is so important, and I think 6 feet apart, whenever you're with a group of people, try to stay 6 feet apart from the person that you're with. I mean, I think all these things are kind of like common sense, but I think they're so very, very important. And one other thing, I impress upon the public not to panic. I went to our local supermarket today. It was the Acme in Ben Salem, and I go there every Saturday at 6 o'clock when they open up. And I'm always the first one in the door. Well, today at 6 o'clock, there was a line of shoppers outside the door trying to get in. And when I went through the store, I mean, it just was amazing. I mean, there were shelves that were completely empty. Water, paper goods, very little milk at all, bread. I mean, they were completely, the shelves were completely empty. Now, the employees were working, trying to restock some of this stuff, which was really good. But please, to the public, the supermarkets are not going to close. Utilities are going to continue to deliver the services that you're used to. You're going to have plenty of gas to put in your car. I mean, and the price of gas is going down, which is a really good thing. So please don't panic. There is no need to panic. We're going to get through this. And we're going to get through this together. If we all just use common sense and we all watch out for each other. And you've got my commitment that the people here in your Bucks County government are watching out for you. So thank you, and good to be with you.
Thank you. And speaking of emergencies, emergency services, Scott Forster, our director, would be the next person to provide some information.
Thank you, Commissioners. To ensure that we can handle this situation appropriately, yesterday morning the 3 commissioners declared a declaration of disaster emergency for Bucks County. We also activated the Emergency Operations Center under their orders to ensure that we could respond efficiently and effectively to all of the situations that may arise. When we talk about a disaster declaration of emergency, it actually loosens up things that the county can do in order to provide assistance to the municipalities and the county partners that we work with in the community all the time. We're able to offer resources, We're able to purchase supplies and services under an emergency procurement without having to go through the entire bidding process, and we're able to do things in a much faster way. We have been providing resources, we have been providing equipment and services and guidance to all types of partners in the community, including the municipalities. The amount of resources that are out there, though, in the way of medical supplies and in the way of other things are very scarce, because there has been a significant buying of some of those things by the general public and a lot of collection of those by citizens. We would ask that you do not go out and just binge buy of personal protective equipment in the way to protect yourself, because you're taking away from healthcare workers, public safety workers, and others. We also activated the emergency operations center in the way to provide alerts, information, coordination to the communities and to public partners. We do that by bringing subject matter experts together from various departments, various organizations around the county in order to solve issues and problems that are occurring. We've been doing a lot of planning and preparation for shortages of personnel, services, or any type of supplies that may exist. At this point, I will tell you, we are not finding a shortage of emergency responders or any services that would impact public safety. The municipalities and the county, we're doing a great job working together. The public is safe. There is no reason to be worried or to panic about this situation. One of the things that we are also working on is we've been communicating a lot with the school districts over the last several weeks, but the latest project that we're working on with them is we're trying to do some planning with them on how we can offer the food services to the citizens and the children of the school districts as they'll be closed. There are some districts that may need some assistance with that. We've been talking to them, we've been offering resources to them, and we'll be offering additional assistance to them as we go through these planning efforts in the next couple of days. Up next, I'd like to introduce Dr. David Damsker from the Bucks County Health Department.
Thank you, Scott. Just to echo some of the comments that you've heard today by the commissioners, in not panicking. The situation in Bucks County hasn't changed a whole lot since the last time I spoke to the press. We have an additional third case that was a person who was affiliated with the CHOP physician who was tested positive. So again, this was an exposure that we knew how it happened. This is not a community spread situation. And we're hoping that as this will continue to be the case in Bucks County. Again, to echo the comments that, even if there are some restrictions and recommendations placed by the government, by the governor, I want to make it clear that the businesses that stay open are making good faith efforts, the ones that I've seen, to improve their services without having to touch the customer, or to space things out, to do takeout if you're a restaurant, to have self-checkouts type situations at their store. And I want us to keep those businesses open, hold them accountable, from the perspective of making sure they're doing the things that they can do to make sure things are clean, hygienic, and socially distant. But I do believe it's very important that we maintain as much of a regular ability, of a regular, regular lifestyle. There are things that may be closed, and there are things that you can't, with schools and daycares that aren't essential. But I want to make it clear, though, that there's nothing to panic about. We're taking this very seriously. And just to put some things in perspective, the state with the largest hit from this in the United States is Washington State. They have 37 deaths from the coronavirus. So far this flu season, they've had 80 deaths from the flu, including 6 children. And I want to put this in perspective. So the worst hit state still has more than twice as many flu deaths, including children, than they do from coronavirus. So I want to make it clear that this coronavirus can cause death, absolutely can cause issues in the elderly, but the vast majority of people who get this, including the 3 cases, I just spoke with our 3rd case yesterday, they are doing very, very well with very minimal symptoms. So I want to make it very clear to everybody here, getting coronavirus is not going to be the end of the world for many, many, many people. And we're doing what we can to prevent deaths and illness at all in our nursing homes. And I believe both a couple of commissioners mentioned that, how strongly we feel that if you can protect the elderly, the death rate from this disease will be way, way down. And elderly people in the Bucks County, they're the ones who may want to think twice about going out to any gathering just to protect themselves. But again, I think we're doing a lot of things. I think, as Commissioner DiGirolamo said, we're fighting hard to maintain a low level of concern by continuing to be serious about this and doing the things we can do. But whatever you do, don't go on social media. Don't post scary things to your friends that aren't based in science. Social media is causing a problem with coronavirus. And I believe that if we can all maintain some sanity, some common sense guidelines on social media, which is really becoming an issue. This wasn't an issue 12 years ago with H1N1. I think it's made things worse. And I'm asking everyone to kind of keep their wits about you, keep the panic down on social media. I think that will help everybody in Bucks County as well as elsewhere.
The next person I'd like to introduce, and I just want to say something real quick. The governor had suggested that large gatherings of 250 or more not be held. We would agree with that. We would just encourage any gatherings to be limited with that 6-foot social distancing rule. But I'd like to introduce Evan Stone from our Planning Commission, who can talk a little bit about the portal that has been developed so we can keep you up to date on all the information in Bucks County all the time.
Thank you, Commissioner. If you look on the screens behind me, you'll see the link to the new data portal that we've developed to help our residents stay up to date with as much information as we can provide. I believe you can access that on our homepage on the website in the upper right-hand corner. There'll be a direct link to this information. And what you're going to find on this data portal are links to the World Health Organization, links to the CDC, links to the Pennsylvania Department of Health, and other essential information that we believe the public should have access to on a very readily and easy basis. So I encourage you to check it out, explore the data that's on there. We have links to the health department. We have an email address as well as the phone number to the health department. So as you're going through the data, if you have questions, please feel free to reach out. And I'm sure Dr. Damsker and his staff will be more than happy to help you.
We'll take any questions that you might have.
Question about testing, is that something that's being set
Sure.
up, mobile testing, drug testing, anything to that effect?
Yeah, we're still in a planning phase for that. We don't have any ability as of today to do mass testing. We are planning on doing some smaller things. You know, the federal government is still putting out questions to the state and the locals about what we can handle and what we can't handle. But as of today, it's still very early in that planning process. I can't tell you that we're going to be doing any kind of drive-through testing. No matter what's said at the federal level, we can tell you at the local level, we're still receiving more guidance and questioning. But they are working to set these up, but we're still a little time away from that.
Can you touch more on the importance of social distancing? We keep hearing about it, we keep seeing groups of people still gathering, you know, maybe not in 250 numbers, but still large enough that they're not seeming to take it seriously. And then how would that impact places of worship? Is there any mandate or anything on that?
Yeah, there's no mandates to, shut down worship facilities. I don't think they were going to do that. But I think the big things are you can prevent, even if you have a gathering of 250 people, if no one shows up to that gathering sick, then it's very difficult to spread disease, right? And I want to just keep pushing that again and again. That's the number one thing, even more than hand washing, more than anything else. Don't go out in the public when you're sick. Because people can hand wash, and if you go ahead, you're sick, and you touch every common surface, you're going to get somebody else sick. And so whether the gathering is 5 people or 200 people, stay home until you're feeling better. I can't emphasize that enough, in addition to the other things about hand washing. We're not against people having, gatherings, especially outside. but obviously not large gatherings over the 250 guideline, but we want people to still live, we still want people to do things and not be shut up in their home streaming Netflix all day. So we still want to live, at the same time, be smart. If you do those things that I just talked about, if you're not feeling 100%, don't go to those things. But we're not going to tell people not to have any contact with other people, because I believe that would ratchet up the panic and may not solve a whole lot of issues.
And then finally, follow up to that, if there are large gatherings, if law enforcement been instructed to spread message, awareness, anything to let them know that, hey, maybe you shouldn't be doing this at this point?
No, I don't believe, no, but I think a lot of the larger gatherings are already all considering postponing those gatherings if they haven't already. In this current state of affairs, I think most of the large gatherings have already been postponed, or they're very seriously considering doing that.
What's the, with the status on the special election until that's postponed?
Well, we've kind of been asking, and we haven't heard anything yet, so we're waiting. Spoke to the governor's office today and asked again, so we're hoping that any time that might happen. If it doesn't, we're prepared to go, but.
And with the emergency services, are there certain special protections, advice given to EMS responders, upgraded precautions?
Are very well educated, and they know the universal precautions that they need to use to protect themselves when they go to certain types of calls and responses. But we have been working with the fire service and the police departments in a way of providing them information about the types of emergency medical service calls that they should reconsider going to, and explaining to them about social distancing when there's situations where there's flu-like symptoms or febrile respiratory issues. So they have been given guidance on those kinds of calls.
And finally, is this outbreak as it stands right now in Bucks County affecting the court system at all? Any word on that?
Well, they're going to be making decisions about the court system on Monday. As of right now, the judge, it will be stopping any jury trials. No, they don't start again for 2 more weeks. But on Monday, they'll be making decisions.
When you said they will be making decisions, is that the county or the state?
That's the judge. The president judge will make that.
Thank you.
I know one thing people have asked about, if they can't, with child care centers closing, maybe Dr. Damsker, what's some advice for if people should have multiple kids in their home, or what are some, do you have any advice on kind of best practices?
Yeah, and as I said earlier, the most important thing is if you're going to have kids in your home is don't come over if you're sick. If you do that and you follow common sense things like making sure the kids are washing their hands while they're playing together, making sure that anything you can think of from a common sense perspective. We have play dates with our kids all the time, but you're not, have them not share straws, not share utensils. I mean, these are all common sense things that I think that most moms know about. But if your kid's not feeling well, but you have to go to work or whatever, don't send your kid to someone's house. I mean, that's just common sense, as much as you want to. But that's the advice we give. We're not limiting the numbers of kids that can come over to your house or anything like that. Just use common sense guidelines.
Other questions? Thank you very much.
Thank you.